Hi everyone, sorry, some technical difficulties prevented me from going ahead. Let me do the final test to see if it is working or not. Give me a second. Perfect. Now we are ready. What time is it? We are 25 minutes behind. Sorry about that. Let's start. My name is Reza. I'm a hypnotherapist, and today is May 23rd. May 23rd is announced as Clinical Hypnosis Day by American Society of Clinical Hypnosis, and this presentation is provided you by American Society of Clinical Hypnosis to celebrate this day. Let's start. As mentioned earlier, my promise would be I will provide you with a link, a YouTube link to a surgery with hypnosis at the soul anesthesia at the end of the presentation. Let's jump into the presentation. The title of presentation is Advances in the Neuroscience of Hypnosis. Let's have a background about hypnosis. What is hypnosis and hypnotherapy? Hypnotherapy is the oldest Western form of psychotherapy, and historically speaking, it has been widely used in pain management, psychosomatic pains and conditions, fears, phobias, habit changes like smoking cessation, exercise compliance, and a lot of other habit changes, anxiety disorders. And the beautiful thing about hypnosis is strongly supported by evidence. So evidence-based medicine supports hypnosis and the application of hypnosis in medicine strongly, and some of these studies are clinical trials. And as you may know, clinical trials are among the studies with the highest level of evidence in modern medicine. The truth is, we know hypnosis does work, and there are tons of evidences supporting that, but we don't know how it works. We know a little about the mechanism of hypnosis, and to be honest, there is no consensus even about the definition of hypnosis. But the beautiful thing is, it does work, and there are tons of evidences in favor of that. These indications that I list here are supported strongly in literature by different studies and trials. Acute and chronic pains. These acute and chronic pains may be attributable to medical procedures, pre or post-operative procedures, dental procedures, labor pains, headache, particularly migraine pain, and it could be chronic pain. Each pain has two components. The first component is a sensory component, and the second component is affective component. I will discuss about these two components of pains in more details later on this presentation. Personally, I prefer to use hypnosis in chronic pain. There are different reasons why, but maybe the most important thing is the fact that hypnosis is a strong painkiller, and it can mask the pain as the most important symptom in any pathology. So if you mask the symptom before getting into the diagnosis, you may lose the diagnosis. So I'm a little bit hesitant to apply hypnosis in acute pains before the diagnosis is finalized, but you can use it in chronic pains easily, because in chronic pains, most of the times the diagnosis is precise and finalized. Irritable bowel syndrome. Hypnosis works perfectly in that situation. Nausea and vomiting associated with chemotherapy. Insomnia. Habit changes, weight management, smoking cessation, exercise compliance. Depression. As you may know, depression has different symptoms and signs, and hypnosis is a strong therapeutic modality to approach a depressed patient. Anxiety, fears, phobias, and PTSD, or post-traumatic stress disorder or diseases. And I would claim that hypnosis is the strongest therapeutic modality when it comes to PTSD, no medication works in PTSD. What medication do you want to prescribe for a PTSD patient? So, excuse me, I would say that hypnosis is the strongest modality, therapeutic modality when it comes to PTSD. And my personal view is PTSD is a kind of hypnosis itself. So your approach would be more dehypnotizing a PTSD patient rather putting him or her under hypnosis. And the literature says that there is a strong relationship, there is a strong correlation between developing PTSD and hypnotizability profile of the patients. And also patients with PTSD respond more dramatically to hypnosis therapy, hypnotherapy over time. So there is a strong link between hypnotizability and PTSD. And this is the area of my research focus, PTSD and hypnotherapy. And this is the review article, mentioned the references below. American Society of Clinical Hypnosis tries to have a simplistic definition about hypnosis. The truth is, as I mentioned earlier, there is no consensus about the definition of hypnosis. And it's much easier to say what hypnosis is not rather than saying exactly what hypnosis is. So let's start with the definition of exclusion, let's say, and to mention what hypnosis is not. And these are the myths around hypnosis. And American Society of Clinical Hypnosis mission is to demystify around hypnosis and definition of hypnosis. So they are focusing on 7 to 8 myths around hypnosis. The first myth around hypnosis, or the first misunderstanding about hypnosis, is hypnosis is a means of controlling someone else. Unfortunately, this misconception is provided by Hollywood movies and TV series. But the thing is, even in deepest trance ever, the subject has control over his or her behavior, and there is a kind of inner observant watching every single behavior and thought. So hypnosis is not about controlling someone else. The other myth is hypnosis is dangerous. That's not true. Hypnosis is not dangerous. Maybe it's the safest therapeutic modality available. For sure, people should not use hypnosis for the medical conditions they are not qualified to deal with, but hypnosis itself is so safe. Some people say that people who are hypnotizable are weak. That's not true. To me, people who are hypnotizable are mentally healthy. The reason being, as some mental disorders, for example, depression can prevent the hypnotizability to be expressed. So some hypnotizable patients, when they are severely depressed, they cannot show their hypnotizability. So you cannot hypnotize them despite the fact that they are hypnotizable. So if they are expressing their hypnotizability to the fullest, it means that they are mentally healthy. They don't have any depression, they don't have any PTSD, they don't have any phobia or generalized anxiety disorder, and so on. The other myth around hypnosis is a state of mind that you can be trapped in. That's not true. If you leave a patient unattended under hypnosis, he or she may get bored and get out of hypnosis, or he or she may go to sleep. So there is no trap when it comes to hypnosis. Some people think that hypnosis is the same entity as sleeping. That's not true. Sometimes people fall asleep under hypnosis, particularly where you are using generalized relaxation, but there are two different states of mind, and there are two different things. Hypnosis is not sleep. It is a different state of consciousness. Some myths say that hypnosis is gender specific. That's not true. Males and females are equally hypnotizable and talented when it comes to hypnosis. And some people say that, or some myths say that people are equal in terms of hypnotizability. That's not true. People are different. To my experience, something like 5% of normal population are not hypnotizable at all. 20% are highly hypnotizable, and the 75% are something in between in terms of hypnotizability. The definition of hypnosis. As mentioned several times, there is no consensus about the definition of hypnosis, but American Society of Clinical Hypnosis has provided us a very effective, simplistic way to define hypnosis. They have adopted this definition by American Psychological Association, and in their definition, there are 3 elements mentioned to define a state of consciousness as hypnosis. The first element is focused attention. The second element is dissociation, or reduced peripheral awareness. And the third element is suggestibility, or being responsive to suggestion. In another word, if someone is focused on something and he or she is dissociated from the environment, and he is or she is responsive to the suggestions induced and offered by the therapist, he or she is in hypnotic state. And hypnotic induction is a procedure we use to induce hypnosis. As you may know, hypnosis has different phases or different stages. The first phase is induction. There are different techniques to induce the hypnosis, and the second phase is deepening. You deepen the trance, and the third phase is suggestion. And in that phase, or the third phase, you apply your therapeutic approach towards suggestions. And then you just lighten the hypnosis and terminate the hypnosis. Hypnotizability is the indicator, or the indication showing how hypnotizable the subject is. And hypnotherapy is the application of hypnosis for medical purposes. Okay, give me a second to get a feedback from my monitor to see how it works. Are we doing good? Perfect. So let's focus on hypnotizability. As mentioned earlier, people are different in terms of hypnotizability, and the distribution of hypnotizability is bell-shaped, like other demographics in the nature. And the thing is, the sustainability of, or the let me read the exact sentence. The capacity of hypnosis has been found to be even more stable than IQ. It means that the sustainability of hypnotizability in 1% over time is more stable than IQ, and the distribution is bell-shaped. You can't change someone's hypnotizability over time. It looks like it is something that we are born with. The fact that how hypnotizable we are. Excuse me. There are different imaging techniques available to map the brain functions during hypnosis. Maybe the oldest one is electroencephalographic studies, or EEGs. We know EEGs for years. So, and as you may know, we have different brain waves. Some brain waves are high frequency, like beta waves. For example, beta waves are between 13 to 20 hertz, and some waves are slow waves, like theta waves, which are 4 to 8 or 3 to 8 hertz. And the hypnosis state changes the pattern of EEG. They increase the slow wave theta bands, and they decrease the high beta brain waves. The thing is, unfortunately, these findings are not specific to hypnosis. For example, under meditation, you see the same pattern. So, to my experience and to my knowledge, you cannot differentiate between hypnosis and meditation when it comes to EEG. But it's just about EEG for functional MRI, it is a different story. Functional MRI, that's the most beautiful imaging technique to monitor and map brain functions during hypnosis. Functional MRI has provided us a great opportunity to monitor the brain activity, the brain function during hypnosis. For example, we knew that hypnotized individuals are reporting, when they are reporting focused attention, they say they are relaxed and they are detached from their stress and anxiety and worries. We knew that for years, for ages actually, but we didn't know the underlying mechanism or the neuroscience of how it works. We have a part of the brain which is called cingulate cortex, and a part of that cingulate cortex is dorsal anterior cingulate cortex, or DACC. DACC is a part of salience network of the brain, and salience network of the brain is responsible for error detection and conflict monitoring. So this part of the brain is very important, and it has been created in evolution to help us to resolve and detect errors and conflicts. But as a result of that, we get anxious. When you put someone under hypnosis and you monitor the brain with fMRI, functional MRI, you see that the function of a dorsal anterior cingulate cortex is reduced. So hypnosis is down-regulating the salience network, and it provides us the opportunity to face the conflicts and to accept the conflicts and errors without getting anxious. It's not mentioned in this presentation, but this is my idea. I'm always thinking this salience network is it has a function in evolution, but it's the enemy of dialectical thinking. But if you make it silent for a moment, you have the opportunity to think more dialectically, or you can accept the conflict or opposites more easily. So in old literatures, you see this as critical judgment. We knew that in hypnosis critical judgment is bypassed, but we didn't know the physiology underneath. Now, with the function of the salience network and the effect of hypnosis on dorsal anterior cingulate cortex, we have a better understanding of why critical judgment is bypassed in hypnosis and why we are less critical under hypnosis and hypnotic state. These are other fMRI findings showing that hypnosis can increase the connectivity of different parts of the brain, and sometimes it decreases the connectivity of some parts of the brain. In this case, the hypnosis increases the functional connectivity between executive control network and a part of the prefrontal cortex. But prefrontal cortex is so sophisticated, and actually the function of hypnosis against that is very different. Sometimes hypnosis increases the connectivity, and in some cases hypnosis decreases the connectivity of different parts of prefrontal cortex. So it's very hard to say that hypnosis increases or decreases. It happens in a very sophisticated pattern. Yeah, this is about the new findings, the new neuroscience findings about hypnosis and pain management. As mentioned earlier, hypnosis has pain has two components. The first component is sensory component, and the second component is affective component. When you are experiencing a pinprick, for example, you are experiencing a simple sensory pain coming to your brain, but it goes up to your cortex, prefrontal cortex, and limbic system, and a very sophisticated cognition, let's call it metacognition, is created on top of that, and it is commingled with your memories, childhood memories, and a lot of other inputs in your brain, and the affective cognition is created, which is very, very sophisticated comparing to the sensory component of pain. And the fMRI has shown us that different parts of the brain are triggered when we apply hypnosis for pain management. Some areas are more relevant to the sensory component of pain, and some areas of the brain are relevant to the affective component of pain. Yeah, so historically we knew that there are two components of pain, but we didn't know that there is a neuroscience basis for that. And functional MRI has provided us the opportunity to discover that and understand the mechanism a little bit better. Okay, I think we are good for fMRI. Let's go to PET scan. Nuclear medicine has provided us a great opportunity as PET scan or positron emission tomography scans to investigate hypnosis. The beautiful thing about PET scan is you can monitor not only the function but also the metabolism of the metabolic processes of the brain, and it is much more precise to monitor the function of the brain. Then the inputs are coming into a computer, and the computer construct and reconstruct the images, and the output is a very precise three-dimensional modeling of the metabolism or the function of the brain to interpret. So it is an old practice and sometimes old game in stage hypnosis to put a black and white picture in front of the subject and ask them under hypnosis to imagine colors. And a lot of people can imagine colors when they are looking at a black and white picture. And it is like a hallucination. And PET scan has shown that when you use this game in hypnosis, it's not just about a simple imagination. It's not just about making up things. The PET scan has shown us that some areas of the brain which are involved in color recognition and color processing are stimulated or are functioning when the patient or the subject is hallucinating about colors. It's really interesting to me because people are not just simply making up things. People are not simply just imagining. People are really seeing colors. And this valuable information is provided us with PET scan. This should be a new article, but I can't see. Yeah, no, it's not really new. It's published in 2000. Okay, and these are the references for what I shared with you. Feel free to contact me if you need the original articles, because sometimes it's not easy to find these articles for free. Yeah, and what I do, I'm a hypnotherapist and I run Theta Hypnosis. And in Theta Hypnosis, I have two missions. The first one is to provide my clients with hypnotherapy. So I try to help people to manage their pains, to quit smoking, weight management, on a broad spectrum of medical conditions and health conditions with hypnosis. And the other mission I have is to provide online courses for healthcare professionals. So I help them to apply hypnosis in their daily practice and transform their practice. Let me show you a little bit about my website. Okay, this is my website. Theta.ca. Theta is the name of the first physician based on Persian mythology. The first physician on earth, I would say, but it's a myth, but it's a beautiful myth. Okay. This is my website, so trita.ca, and this is my own practice. So if you want to go to my own practice website, you can click here, or you can click here and go to my personal website. In my personal website, you can see my services, you can listen to a testimonial of one of my clients. There's a web blog I post almost every week. And these are the medical and health conditions. And if you click on one of them, let's say pain management or inflammation, you can see the evidences in the literature supporting that. This one is, this article is about hypnosis in arthritis. This is my client's website. And how about the healthcare professionals? Healthcare professionals can go here, hypnotherapy online courses. They click here. Then they are going to my landing page and they listen to a video about the course. They enter their name and their email address, and then they press get free access, and they get a free access to a demo version of my online course about hypnotherapy. My online courses are consisted of pre-recorded videos, one-on-one coaching sessions, and interactive modules. Yeah, I think that's pretty much it for today. Oh, I promised you to give you the link for surgery. This is the link. Feel free to take a photo of that. I just play a few seconds of that because I'm not sure about the copyright of this video, so I'm not gonna play that completely. I don't play the sound. I just want to show you to have an idea of what this video is about. So yeah, thank you for your time. Thank you for listening. I just say goodbye and play this video for you for a few seconds. Thank you. Happy clinical hypnosis day and enjoy the rest of your day. Thanks for listening. Bye now.